So my practicum placement was at Videa. And okay, oops. So Victoria International Development Education Association, also known as Videa, is the company I was working with during my practicum term. The organization's goal is to create better circumstances for youth and communities all over the world to have access to the education, knowledge, skills, and support they need to take charge of coming up with long-term solutions to environmental, indigenous, and civil rights violations and inequities. Videa was first established in 1978 and was among Canada's first global learning centers to foster a better comprehension of other cultures and global awareness of concerns. While working with Videa, I was able to meet with many teams and learn about their respective projects and programs. These teams consisted of the Climate Action Team, Anti-Racism and Inclusion Team, the Gender Justice Team, and the Reconciliation and Indigenous Wellness Teams. Many of the teams offered workshops, outreach, and community support projects, and other global programs tailored towards youth within communities around the world. So during my practicum placement, my expected roles consisted of attending meetings and engaging with team members, observing and learning from information being shared, conducting research on Videa as an organization, and then creating my own toolkit to be used within the organization regarding cultural safety and capacity building, specifically within Indigenous health and community services. A lot of the framework for my toolkit was derived from previous coursework from my Health 403 class at the University of Victoria. The structure and topics of my toolkit included defining what a community is, understanding positionality, cultural safety, community readiness model, and the pre-planning stages of community readiness, as well as the levels of capacity building. My 3 PHSP values consisted of demonstrating critical analysis by drawing on principles of social justice and equity, incorporating diversity and cultural safety methods or values into work, and describing community-based approaches taken to research and knowledge development. My first learning goal was to demonstrate my understanding of the role of community engagement and community leadership in promoting health and social justice. This is directly related to the BA skill and competency of community and capacity building through inquiry and analysis. So some of the tasks that I did to achieve this goal were to engage in conversation with team members, review the organizational resources and research articles that had been provided, and then also incorporating that into the work I was doing. I've also incorporated my learning into my current coursework and culminating paper assignment, and then have also sought opportunities to share my learning with Videa staff members. My second goal was to familiarize myself with the mission and operations of Videa and increase my understanding of policies related to equity and anti-oppression. This is related to the BA skill and competency of demonstrating an understanding of the conceptual foundations of public health and population health, including ethics, health equity, and core functions. Some of the tasks that I did to achieve this goal were participating in Videa team meetings, reviewing publicly available policies and frameworks related to equity, anti-oppression, and ethics within community organizations, and also working with Videa staff to identify project proposals or research reports that I can conduct or contribute to in some way so that I may enhance my understanding of the work that was being done by the organization. My role in each of the meetings I attended was the role of primarily a listener, which meant I was supposed to listen to what was being discussed and gain knowledge from each speaker. I would also have opportunities for feedback. I spent a lot of the time researching and reviewing equity-based policies to gain a better understanding of Videa. My third learning goal was to demonstrate knowledge of skills in health research literacy by conducting mini literature reviews relevant to the organization. This is related to the BA skill and competency in the integration of evidence-based literature. A task that I did to achieve this goal was to conduct a literature review and prepare an annotated bibliography on a topic relevant to the organization. The project included topics related to cultural safety and capacity building in Indigenous communities for health and community services, and then also knowledge translation strategies in health and community services as a whole. I have also shared my findings during relevant team meetings. The focus of my literature reviews was to gain a higher understanding of the content being addressed each week for myself primarily. Some of these topics included gender-based violence, cultural safety, and equity. For the topic of gender-based violence, I created a report with an annotated bibliography of my findings, and it was mostly focused on statistics and facts that stood out to me when I was reviewing and analyzing and reflecting on the information I gathered through just like overall literature reviews. I later reported my findings to a team leader on the inclusion team so that she could use the information for a report that she was conducting herself with the larger team. While I do not have any influence over funding or the delivery of programs, what stood out to me among the calls to action in the Truth and Reconciliation report was the quote stating, "We call upon the federal government to establish multi-year funding for community-based youth organizations to deliver programs on reconciliation and establish a national network to share information and best practices." I believe that this guided a lot of my focus for my work during my practicum term, as I wanted to create a toolkit for best practices aimed towards the staff at Videa regarding cultural safety, reconciliation, and capacity building within health and community services, so that people would have like a toolkit that they could potentially refer back to or use in some capacity. I believe that understanding cultural safety is not only important within the healthcare sector, but all workplaces as well. Um, so that we as policymakers and healthcare workers can assure fair and equitable care. As a graduate of the BA in Health and Community Services program, I hope to eventually at some point in my career operationalize my chosen call to action by one, assisting in the creation of frameworks related to cultural safety practices, and two, pushing for the sharing of information and knowledge regarding cultural safety as a policymaker working within community health organizations. And then lastly, just some key insights I had. So the most fulfilling aspect of my practicum term was being able to create my toolkit project. This toolkit allowed me to use a lot of the information I learned from previous classes and apply it to a practical project, such as the literature provided in Health 403, as I mentioned before, which helped me frame a lot of my toolkit's content. This toolkit also allowed me to reach my practicum goals and competencies. And another aspect of my practicum term was the weekly meetings and workshops I attended. I learned a lot from other members of the Videa team and was able to understand the kind of work they do, such as the projects they are working on and some of the reports they are working on to present to stakeholders and governments. And lastly, I'd just like to thank my course instructors, classmates, practicum supervisor, and team leader at Videa. Thank you.